Are you suffering with the heel pain? The two, when you wake up in the morning, you are suffering with the heel pain? Then this video is for you. Don't worry, you are at the right spot. Okay, that is called as calcaneal spur. What is calcaneal spur? Why does it affect the heel area? Why does I get pain only in the morning when I wake up? Why I am the only person who is suffering? Why I got this one? What is the reason? Everything will be answered here. So watch this video till the end. Myself Dr. Mega from Homeopathy Clinic. I am practicing homeopathy from 5 years and I am an Okay then, come on, let's talk about today's topic without any delay, that is calcaneal spur. What is calcaneal spur? In the heel, one bone is called as calcaneal. The name of the bone is called as calcaneal bone. So the calcaneal bone develops some calcium deposit on that. Because of that, we call that as calcaneal spur. Okay, that is the only reason this name is there. Okay, first we will understand what happens, why it happens, why the pain is more in the morning, and why the spur is coming out of that bone only, and what you can do for that, and how you are going to get the treatment for that. Okay, first we will be knowing about what it is. What is calcaneal spur? Calcaneal spur is the bone which comes out from the calcaneal bone. Okay, that bone is called as calcaneal spur. The extra deposit of calcium, which is also looks like bone, we call it as spur. Okay, first we'll come to know first we came to know that what it is. Now we'll come to know about why it is actually formed. Chronic calcium deficiency forms this kind of diseases. The people who are suffering with the chronic calcium deficiency, who have calcium, very low calcium, especially the women, okay, especially the women age group of 35 to 50, you can consider, who will be suffering with this calcaneal spur. Chronic calcium loss in the blood. Okay, when there is calcium deficiency, but the blood has to send the calcium to other parts. So what the blood does is to maintain the calcium levels in the blood. To maintain the calcium in the blood, the body does two things. Especially what it is means, it takes the calcium in the blood. When the calcium in the blood decreases, the pH also decreases. Then the bleaching happen. What it is bleaching? Bleaching happens from bones for the calcium and for the minerals, to maintain the blood calcium and to maintain the pH of the body. Because of that, calcium levels is then, which should be decreased, will be increased. And it is also kind of done with an parathormone release. When this activity happens, the hormone which is released is called as parathormone takes place. It will try to increase the calcium in the blood. Why this process is taking place, one hormone also releases, that is osteoclast cells get released. Osteoclast cells which are really not accepted by the body, but in this process it is being released. So now it should go and store in one of the body parts. So it does not have any kind of place to go and stay, and he does not have any kind of work. So what it is going to do is, what osteoclast does, it is, it drills the bone to extract the calcium, and it sends to the blood, so that the calcium in the blood gets maintained. Okay, let's have and look at, we have so many bones. But why the calcaneal bone gets the calcaneal spur? Because this osteoclast looks for an junction which is an tendon bone meeting point, but that is found in the calcaneal bone area. Because of that, there the extra bone development is seen, means the spur formation is seen. Okay, then we will look at why this pain comes in the morning. What are the reasons and what are the causes and what are the symptoms? First thing is rapid movements and friction. There is so much of friction, means whenever you walk there is a friction. Because of that the patient complains of pain. But some people also says that whenever they wake up in the morning and they put the foot down and they have this pain, after half an hour they are not having this pain, just because the body was in the rest position and in the supine position and it was relaxing, the pain was not there. But when the body gets down off the bed, the whole body's weight is on the feet, right? Because of that the calcaneal spur bone is also kind of external bone. Of course, its duty, whenever something is external in our body, it troubles us, because the nerve ending touches that bone and it was an activation of movements. That time the patient gets this kind of pain. I had two patients who was complaining about early morning pain. After early morning waking up, they used to have 10 or 15 minutes pain. After that there is no pain, whole day there is no pain. But some people will be saying all day there will be pain, whenever they are moving, whenever they are sitting, every day the pain will be there. But two patients was very peculiar. Okay, it differs, but the diagnosis is same, that is the calcaneal spur. Okay, rapid movements and friction. Another one thing is obesity. Another one thing is poor nutrition. The patient is not taking the calcium, vitamins, or beta complex. Nowadays you can see that there is so much of poor nutrition because of the change of lifestyle. We are more into the junk food, or we skip the meals, or we does not have what is nutrition, we just have rice, sambar, or some things. Because if you look at the plates of old age people, they used to have everything like curries and sambar, curd, everything was there. So it was a mixture, they used to get everything in order every day. But now it is not been happening, and now the sedentary life, like the women's will be inside the home only, they are not going outside, they are not doing the heavy physical activity, everything the machine is doing, and they are just kind of killing the time, and because of that all this thing has been happening. So calcaneal spur happens when there is this three factors. And another factor which I had observed in my clinical practice is like a police officer, like traffic police officer, or the school teachers who is having a long standing their jobs, you can also kind of thing. And the woman who is standing and cooking for longer hours, like joint family, like that, I'd also seen the patient suffering more on that. Okay, if this should not happen, means what you should be doing, means now it is in the initial stage, it should not go to the final stage. Doctor, just give me a suggestion what I should be doing. If you're asking me on that topic, what you should do is, you should take intake of calcium should be minimum, means drinking milk, the calcium level increases. Taking ragi in your diet, calcium level increases. Or taking lotus dry fruit, calcium level increases. Like this, which are rich in the calcium or vitamin C, you can just take it. And you should always kind of managing your lifestyle, means you should also look at your body, means your body gives you the signal whenever something happens. That time you should just go to a doctor. You should say, this thing is happening to me, is there some deficiency? I'll just take a look at it, and you can just correct it by taking the thing which you are deficient. That time this kind of thing is going to be avoided. Okay, some people, okay, what are the treatment part? In homeopathy we give the tablets to dissolve that bone which was externally formed because of the calcium deposit, because of the bleaching which happens in the all long bones. The extra calcium comes and get deposit in the calcaneal spur, and it also looks like a bone. In homeopathy what we give is, we give the medicine and it dissolves by itself. Of course it's a long treatment for 3 months to 4 months to dissolve that, it takes time. But in the homeopathy or in other system of medicine, what they do is they just go with an simple surgical treatment. They insist to take out that cut out that bone so that the pain decreases. You can just go with the treatment. For my opinion is that dissolving without operating is better, because when you cut down it may grow back again, but treating the root cause is very important. 3 tests you should do before you know about your calcaneal spur is that calcium levels you should check, next one is parathormone levels, next one is vitamin D levels. Okay, these 3 you should check. If there is elevation or deficiency in this thing, then you should go and consult a doctor. If you want an homeopathic medicine which is helpful in the treatment of calcaneal spur is that calcaneal floor. Potency is, you should go with 6x potency, or you can also go with 30 ch. What are the times? You just DM me. Thank you.